Alright, as always, you can go to YouTube channel My Medical Nightmare and see 40 plus hours video on everything that happened to me. Alright, another huge article out of the Milwaukee Journal Sentinel, the largest newspaper in the American state of Wisconsin. 3 weeks after a devastating cyber attack hit the computer systems of major U.S. health provider Ascension, 19 states, 140 hospitals, 160,000 associates, 36,000 affiliated providers. Now, an interesting thing has happened in the public discourse following this cyber attack. As you can see, in over 60 hours of video documentation, recorded phone calls, uploaded medical records, and correspondence between Ascension, its affiliates, its partners, etc. on this YouTube channel. Ascension is a bad business. They're rife with corruption. They're responsible for damage to countless numbers of people. Many mainstream media outlets have been besieged with customer and patient complaints involving Ascension. And the Milwaukee Journal Sentinel on June 3rd, 2024 has brought these matters to the fore. Headline reads, "No one else seemed to care. Patients reach out to public investigator about medical billing issues with Ascension insurers." They describe here patient customer testimonials. One claims Ascension attempted to bill them for an annual wellness visit. The charges were covered under their Medicare health plan. Patients attempted to call Ascension. After 5 months, the patients reached out to the newspaper. The newspaper brought the issue to Ascension. And 4 days later, one customer patient got a phone call that the bill was dropped. I had a similar experience when dealing with Ascension and their attendants and partners. If they think you are uninsured and don't have a way to pay, they will continue to argue and send bills through the mail, I believe under the assumption that they think that you're weak and can't defend yourself. What I've shown in past videos is when the patients and customers that have a problem go to organizations such as the insurance companies or Veterans Affairs, etc., and get them involved, all of a sudden they'll get a phone call or letter stating that the issue or bill has gone away. So this highlights a very important fact. The Milwaukee Journal Sentinel claims they've received dozens of emails and calls for patients and customers who have had billing and service issues with Ascension. Another patient here mentions how Ascension makes obligations to return phone calls on business issues or be sent a written letter in the mail, and they never call back. This is my experience as well. And what's obvious about this is that Ascension's customer service is not professional. What you can hear in my videos is there's 2 basic levels that people will deal with in these medical outfits where I'm located around Birmingham, Alabama. The front end, receptionist, front desk, etc., is like dealing with people out of the inner city ghettos. Alright, when you go up a level to the lower management, it's like one of those old Western movies where the guy walks into a saloon and they're all the outlaws gathered playing poker in the corner of a room.
You've reached the Ascension System Office General Mailbox. After the tone, leave a detailed message and someone will respond to your call. Thank you.
I'm trying to reach CEO Joseph Impicciche, and he can contact me at that number, and I have a message that I would like to give to Ascension. Between 2018 and 2019, I was an emergency department patient at Ascension St. Vincent's East Hospital in Birmingham, Alabama. I believe I had broken my neck. I had an x-ray, 2 CT scans, and later an MRI looked at by Ascension St. Vincent's doctors. Each time they had told me I had no injuries in this area, I knew their diagnosis was an error as my condition worsened. The area became infected and infested with parasites. By summer 2019, I almost died. I obtained my medical records from your hospital along with the X-ray, CT, MRI imagery, and discovered the truth of my injury. I had broken bone in the underside of my skull in the area of the condylar canal and occipital condyle. How the doctors could have missed such a large and serious injury over multiple hospital visits is inexcusable. I believe some element of organized corruption may exist in this hospital. I have compiled over 10 hours of video documentation on what happened to me on my YouTube channel, and the name of the channel is My Medical Nightmare. I believe I may have been a victim of patient dumping in the course of my seeking treatment, which is a violation of EMTALA, E-M-T-A-L-A. When I told medical staff associated with Ascension about my discovery that I had been misdiagnosed repeatedly, I was personally attacked and my psychological state was challenged, and this is reflected in medical records I obtained later. I could not obtain proper treatment or diagnosis for this injury because doctors and nurses that I would subsequently have encounters with would only entertain what the erroneous Ascension ER findings were. My mother, who was a nurse for 20 years, had the misfortune of working in an Ascension hospital. When I questioned my MRI findings involving St. Vincent's Ambulatory Healthcare Network, LLC, and Dr. Michael Brandt Ruff, MD, radiologist, in March 2019. My mother, who was a nurse for 20 years and worked in the Ascension Hospital, she was terminated from her job there around the same time. And so this phone call, I challenge the misdiagnosis of Ascension St. Vincent's East Hospital, Birmingham, Alabama, and I challenge the policy of this hospital. And Mr. Impicciche, I think you need to look into this, please. Please listen to my message, look into what I'm saying, and you're free to contact me. Thank you.